Welcome to Coffee Talk with the Cajun Mamas. Grab a cup of coffee, settle in, and let's dive into real conversations about life, motherhood, and a little inspiration to brighten your day.
All right. Well, welcome to Coffee Talk with the Cajun Mamas. Today, we have a special episode. I'm so excited about it. My little cousin Emily's with us. And we're going to be talking about holistic health. Not so much, super duper crunchy. So, stick with it. I promise you're going to like it. It's going to be really fun, a good conversation.
And you might learn some things.
And you might learn something you didn't know you wanted to know.
That's right.
So, but first, let's talk about our grand sponsor, Long's Products, our favorite janitorial supply out of Alexandria. They are family-owned and operated Louisiana business since 1950. They in their third generation of operation. So, y'all know shopping with a family is so special to them. They actually do a happy dance when you shop small. That's and right. They actually have their own brand of chemicals, the Pelican brand chemicals, so popular on TikTok. You can get them on TikTok, Amazon, at Long's Products is their handle on all the socials. And longsproducts.com has everything you need to get that house clean or any place clean, really.
Yeah,
your
commercial
business
or house, whatever.
Absolutely.
Yeah, and then all their stuff is super concentrated too, so it lasts a really long time. You can get free delivery to commercial accounts if you're in their area. And if you're not, they'll still deliver to your house, right?
Huh?
Go to the website.
They send stuff to my house in Church Point.
Yeah, that's right.
It can be done. All right. So this is exciting. So this is my cousin Emily Alamo. She is the owner and operator and receptionist and all the things. Nurse practitioner at Renewed Vitality. Y'all have heard us talk about Renewed Vitality several times. But we actually were blessed with the opportunity to have an appointment with her recently. Yep. And our minds were absolutely blown.
Yeah, because it was different than any other type of doctor visit. The questions that you asked were just more it more resonated more with me than just like normal doctor questions,
and they just kind of, how you feeling, how you doing, you okay,
how you doing. Yeah,
it was like, well, I don't know, I
what do we get asked usually at the doctor? When was your last cycle?
Yeah,
any pain, any issues, and that's it.
Yeah, she asks specific questions that I wouldn't have been thinking about. When you go to confession and you're like, this is what I did, and anything else I forgot. But anything else I forgot could be a lot, So, this was like more specifically, to, and so I guess what I want you to do right now is tell us about Renewed Vitality. Tell us about it.
So Renewed Vitality is my business. I just opened it in February of 2024. And so it is my practice as in the state of Louisiana. I do have to have a medical director and a collaborative physician, which I do have. It's Dr. Edward LaFleur, and his practice is in Youngsville, and he's more of an integrative functional provider. He's MD VIP, so he doesn't accept insurance. But you do find that a lot of the functional providers, it's not typically covered by insurance, the functional labs, the supplements. So that's why they don't typically accept your insurance. Right. Because your healthcare insurance is going to cover the bare minimum. And so what we do is we do offer that, I like to call it more of that functional, and kind of meet y'all as well with that conventional side with my background,
Exactly.
So I do offer comprehensive hormone replacement therapy, comprehensive hormone testing, comprehensive stool testing, heavy metals, mycotoxin testing, those types of things that you're not going to get in your conventional office visits. Insurance doesn't cover those labs, and
I can just go down the rabbit hole, but why? Why don't they? Because we can really find out a lot about ourselves.
Right? It's true. Talk about.
And actually, address the root cause instead of masking the symptom of it.
Medication.
Right. With medicine.
And that's what we wanted to achieve with this podcast episode specifically, was to let people know that there are other options if you don't want to go
The traditional
traditional
route,
route.
yeah.
Not that there's anything wrong with the traditional route, but like if you're a person who's kind of skeptical about medicine,
Mhm.
like this was just such a breath of fresh
or
air.
if medicine is kind of like you want that to be your last result.
Yeah, yeah.
Resort.
Yeah.
And so I started this because, I mean, I've been practicing and doing the conventional route. I mean, even from my training in RN school, I was at one point very conventional minding, like, you know, vaccinate your kid, all the things,
Mhm.
right? And so I guess COVID burnt me out and a lot of other providers. And then also seeing the state of our healthcare system, our country in general, the state of Americans, we're a sick country,
Yeah.
right?
Mm-hmm.
The amount of chronic disease, diabetes, autoimmune disease, I could keep going, cardiac
Mhm.
Yeah.
disease,
Mhm.
right? And then link that to our food supply.
Mhm.
Oh, yes.
Some of the other things. So I guess just getting burnout on, okay, I'm seeing these people, not really helping these people. I'm just like prescribing these medicines, you know what I mean? And I guess it took a personal, even in my own personal health journey, I'm very like opposed to medicine.
Mhm.
You know, even though growing up, I feel like my mom brought me to the doctor a lot and
Mhm.
I was on a lot of antibiotics as a child and all the things. I don't want to tell you, I don't want to
Yeah.
take medicine, but I've
No.
always been more holistic and health conscious.
Mhm.
You know what I mean?
Yeah, you really always have been.
And so when I had my own issues and I just felt like there's another way. And
Mhm.
so I started reading more about functional medicine and looking more into holistic and alternative options. And then I just fell in love. Like, this is what I really need to do to help
Mhm.
people,
Mhm.
you know?
To help people. When she
To
said
help,
that, like
yeah.
when you go into that kind of profession, like to me, you go into it to help people, right?
Mhm.
Really,
Right.
any profession.
Yeah.
But
And like, I always think about this, like, what did we do before medicines? Like,
Mhm.
before you could get a pill for your cholesterol, before you could get whatever, what were the options? Like, natural things like herbs,
Mhm.
Mhm.
the foods, certain foods with higher vitamins in them and for certain things that you need.
carrots, they're good for your eyes. Didn't they tell us that?
They did tell us that,
Eat
yeah.
your vegetables. They didn't tell us that for no reason, you know?
I know. So, I mean, I don't know why we've come so far from that as a people, as a world. But there's probably other parts of the world that still are more of that natural than the United States. Do you
Mhm.
feel?
Yeah.
Yeah.
I mean, obviously we're very modernized here.
Mm-hmm.
And all the additives they're putting in our food and, you know, those red dyes and all those artificial dyes have been linked to hyperactivity and ADHD, right?
Mhm.
And so now I'm very happy that RFK
I saw
is
that.
going to make America healthy again, and ban some
Those
of these
dyes.
things in our
I
food
did not
system.
hear
'Cause
about
in
this.
Europe and in other countries, like if you look at what's in our products, like they ban that in other countries.
Oh.
Even in our
Doesn't that
wine,
say a
you know,
lot?
even in our cosmetics,
Mhm.
our household products,
Mhm.
right? And so I was listening to RFK this morning, and he's
Mm.
like, "Our kids are living in a toxic soup," and it's true. And not just
I'm
our kids.
so glad
We
that this is
all
being brought to
are.
light.
I know.
Mm.
Yeah.
It's I
You
mean,
happy.
I'm
I
so
can see how
interested
the
in
joy
this.
on your face
Yes.
right now is so.
Oh man, but just the other day, okay, so we went to the we went to Renewed Vitality. She saw us. I'm gonna just open up about this. Then she called me and said, you know, you have hypothyroidism. That not surprising to me because my mama, you know, my mama has this. We have thyroid problems. And then she said, I said, okay, but what can I do about this? She tells me, you know, the kind of diet that I can go on and we're doing better. And then she says, there's this medicine and but it's not FDA approved. And I
Mhm.
was like, that in and of itself tells me that it probably works. You know, I'm just like, I don't really care, you know? And but my husband was like, you're right. You know, like if you say it's gonna help, you know, If she says it's going to help me, it probably will, because they don't want you to know, you know.
Well, it's FDA approved for certain conditions, just not for that.
Oh,
We'll put it that way.
yeah.
Okay.
You know what I mean? But it is an alternative treatment, and I'll be
Mm-hmm.
putting it. What specifically was more of like an autoimmune thyroid condition is what it is, and then a lot of the autoimmune is linked to gut dysbiosis and gut health. If you remember at your first one, we were covering a lot about, okay, we really do need to work on your gut health because there's some triggers here, and it's not normal, you know, to have to take a medication every day in order.
Yes, yes.
You know, and so there are ways that we can naturally support that, right? And so a lot of what the whole like the functional medicine, and it's all root cause, but it's not like in conventional medicine. Let's say it's all like disease system, like it's acne, it's kidney disease, it's heart disease, but really it's all interconnected, right? Does that make sense?
Yeah.
And then what is causing it, you know, food. We look a lot at food, nutrition as medicine, and how your body can heal itself.
That's how come people don't want to turn to this way too, because it's a big commitment. It's a big commitment on the person when you can just take a pill, or you got to change a lot of other things. But what's really what is more important to you? You know, that's what you really have to come down to, is how bad do I want this issue fixed, or do I just want to?
Right. Well, I mean, just think about a car that runs. You want, say like my daddy, you want the one with the trash and the gas, or you want the good, you know, the good gas. Well, I used to say all the time when I was really on my nutrition, I would say, I got to keep this machine running optimally. Well, that's nutrition. What are you putting in your body, you know? And I know, y'all all thinking, but fool, you is just making a tasso pizza. I know. But, you know, that's just a small thing of what you might see, especially now since I went, and she's got me back on track.
Back on track,
even if we can do a 80-20 rule, or like a 90-10 to where you can still enjoy some of those things. But
the bulk of your diet.
Yeah. And it does take discipline. And then some of the supplementation and even some of the functional lab testing can be a little bit pricier, but it's like trying these things first, right? Before we go into expensive testing and doing it only when necessary. So that's why it's very important for me to ask, okay, how are you sleeping? Are you getting your 7 to 9 hours, or are you only sleeping like 4 hours? Because before I even order we need to work on that, right?
Did your doctor ask you how you sleeping?
Like, how much water are you drinking? Are you getting the amount of water you should be drinking? How is your stress level? You know what I mean? Like, how are we well, I feel like everybody's stressed.
We all feel stressed. We all stretch ourselves way too thin, you know? But yeah, it's you even have tips on how to manage that kind of thing.
Yeah. And then what are you eating? You know, what is your diet consisting of? Like, and I do ask like, tell me what specifically on one of my intake forms, it's what did you eat in the last 24 hours? How many fruits or vegetables do you think you get in a day? How much protein do you think you get in a day? Because all these things are important.
Yeah.
And then I do just feel, you know, with insurance dictating healthcare providers on how much, you know, how many patients they can see a day in order to be profitable and to sustain their practices. You know, they kind of do, you know, the model is set up, you know, that you do get reimbursed by the amount of patients so I think the average office visit is about 15 minutes, you know. But they do have providers, they do take time with their patients, you know, who,
because that's one thing that I noticed too. Like you spent your time with us, you know, like, and that's not everybody. Sometimes they in and out. And that's, here you go, bye. And here you go, bye. And then you are constantly going back, you know, like a simple sinus infection, you know, that could have been dealt with by just, you know, maybe
nasal rinse,
you know, something really simple. You didn't went
neti
and a neti pot. You went and got all kind of antibiotics.
What's triggering that allergy too, you know?
So I guess, yeah, I just wanted people to know there are other options because that's what struck us. And when we got in the car, I was like, that was so good. I think people need to know about this, you know? And so there are, this is out there, you know, this is out there. This is a thing.
Yeah.
And I'm so glad it is. Let's go ahead and take some time to talk about sure title and abstract.
Yes. So Sure Title and Abstract, you can choose them for all your title needs. Sure Title offers services such as residential and commercial property closings, business setups, title transfers, donations, and successions. Attorney Maria Petrie and the team at Sure Title are ready to help you make your property transaction as smooth and easy as possible. You can contact them at 337-451-5959 or visit their website, thesurechoice.com. Make the sure choice. Choose Sure Title for your closing. Do you find that there's a commonality, like a common thread for women specifically that feel like very stressed, like anxiety?
Mhm.
Well, this is probably two separate issues, but like no sex drive or low sex drive.
I was hoping you would bring that up because she did ask
I mean,
us
that's
that.
very important, especially as women. Men too, you know,
Yeah.
but like we usually attribute it to, well, I'm just so busy all the time. Like I don't have time to even think about that, much less want to do it. You know what I mean? So, but there could be underlying causes like hormonally
Correct,
that are
yeah.
making you feel that way.
Yeah, and so I do get a lot of women, they're in perimenopause, and I just have one of my girlfriends, actually, she was texting me last week. She's like, I don't feel right.
Is that
And
premenopause? Like
it's the perimenopause is kind
because
of
I've been
like
hearing that word a lot lately.
that time before actual menopause.
Okay.
And it can happen 8 to 10 years before, you officially go into menopause. But some women start having symptoms even in their 30s.
Wow.
I had a good friend of mine. She started having symptoms. She was 32. She was having severe anxiety just out of nowhere, panic attacks. And so they were like, you have anxiety. Let's give you this
anxiety meds.
this SSRI. And she's like, but wait, I'm like the happiest I've ever been. Like I'm not stressed. I don't know where this is coming from, and then sure enough, her doctor did a hormone panel and she had low progesterone, and I do think at that time, which she was going through peri because her last cycle was at 39, right? So women do experience these symptoms and can go into like an earlier menopause than your average age of 55.
Oh, wow.
So, yeah, I mean, if you're feeling run down, if you're feeling like, you have a lack of that desire, or you're also getting like this new onset, like anxiety or mood changes and not feeling yourself, it's definitely worth taking a look at that hormone panel and seeing, what's going on.
Yeah.
And, for ways to optimize your hormone health, right, would be to get adequate sleep, definitely avoiding alcohol if possible, because that's going to affect your sex hormones, making sure you're getting the adequate dietary fats for hormone production. What else? I could go on about the endocrine disruptors and how that's affecting
that's like in our
women's
cosmetics
hormone
and
health,
skincare
right?
and all those things, huh?
Yes.
Yeah.
And how and gut health too, because if our gut is not working, because that's how we get rid of that excess estrogen. It's through our, it's detoxified in the liver, and we're getting rid of that through our bowel movements. And so if we are struggling with our gut health, we're definitely going to have.
We're holding on to all of that.
Yeah, but then we keep putting all these toxins in our body, that's
and it can't keep up,
increasing that load, and the dangers of that with too much estrogen over time could lead to breast cancer.
Okay,
this is so interesting to
me. I know. Yeah.
Do you use any apps on your phone to help you find the best products or groceries? Or
there's the Yuka app, and then there's the EWG app.
Okay, I have
I've heard of Yuka one. Yeah.
So
I have that. I haven't used it yet, but I have it on.
That's what I do tell my patients to do. You can scan your product, and it'll kind of tell you.
Man, it about broke my heart whenever I scanned. So I had some Bath and Body Works shower gel.
Probably the worst, huh?
Anything Bath and Body Works. I mean, I'm sorry to say this. I love it because it all
Oh.
smells so good.
Yes.
But like anything with like artificial fragrance is so not good for us, y'all.
Mhm.
It's
I
not.
know.
Yeah.
And it's like it's going in like it candles. It putting it on your skin. It's all
Yeah, I know.
you know,
And we don't
not
think
too
about how
great.
fast that gets absorbed into the bloodstream. And we kind of, I mean, that's kind of one reason we like our Lime Life skincare because it doesn't have none of those hormone
horse skin-
disruptors
yeah.
and stuff in it. But if you don't know, you don't know.
Mm-hmm.
So now you know.
Now you
now
know.
you know to check your
Yeah.
makeup brand.
Check your deodorant.
Oh my God. But do you know like what it's we'll talk about
Tell
male
me.
fertility and like ED in men and like the low testosterone.
Tell
in
us. Okay, I
males.
wanted to
And so,
talk
like,
to
how
speak to our men
about
too.
men too,
certain
yeah.
deodorants are even, affecting
Mhm.
their testosterone
Oh my
production.
God.
Yes.
So
That's
high heavy
scary.
metals in it, you
Mhm.
know. And
Getting that like an aluminum free
yeah, my husband and
and
I
a
have been using
cleaner
aluminum
deodorant.
free, and
That's something I never thought about because for me, I know like our norms are so close to our breast. It's like a no brainer for me. I went all natural several years ago, but the men, like I didn't think about that. That it can be harmful for them. Their deodorant too.
Mm-hmm. Their body wash.
Yeah.
Yeah, their body wash. But just thinking about it for our kids too, our kids get to a certain age, what if we started it now? You know what I'm saying?
Yeah.
What if we
Right.
started it with this new generation and they just don't know any different?
Yeah.
Just like we would rub on our teen spirit, they have a different
Yeah.
option,
But
They,
also the sweet pea and the cucumber melon too. We
Mhm.
would douse ourselves in
what?
that
oh yeah. Can imagine
in our preteen,
know?
teenage years. You know what I mean?
I wonder what that
Oh,
did
yeah.
to us,
Oh yeah. Or
Um,
lathering up the tannin lotion and laying in a tannin bed. If you
Oh
really
my
want to talk
gosh,
about
if
how
we
much
really
damage
crying
talk
our
about what we
ovaries
did
and
to
wondering why we
ourselves.
can't have babies. You just
But-
don't know.
But then,
Jesus,
now
take the
they're
wheel.
saying what's in our what is in our kids' school lunches, in
Oh,
the food.
Lord,
How
help.
can we know? And
How do
we're
you
paying out the
know?
wazoo for them.
Mhm.
Right.
Oh, not me personally anymore, but
Yeah,
I know people
I know you're
who are.
homeschooling now, but I think people are opting to pack lunches, but it's still, I know as a working mom, it's stressful to try
Oh,
to
yeah.
figure out, okay, I got to get X, Y, and Z ready, get the kids ready for school. Now I got to worry about what I'm going to pack them
For lunch.
Mhm.
for
Yeah.
lunch. It can be overwhelming.
Mhm.
Yeah.
Mhm.
Oh, it's so much more expensive,
It
to eat
is.
healthy than to eat crappy. Because you can buy a whole meal,
That's so true.
in a brown bag for way less than what's gonna be something
Then,
good
like
putting in your
meat
body.
and a salad or some
It
vegetables.
is.
Like y'all, they have made it so impossible. Not impossible, but so hard to go. You go buy groceries in the fresh produce section, and you got $300 worth of groceries for just a few meals. But
Mhm.
you can go get the frozen foods all day long. And it's
Mhm.
ugh.
Yep.
I
They're
know.
making it almost.
But you pay
impossible.
that, or are you going to pay a doctor bill?
Right.
That's
so
what I
yeah.
look at too.
healthcare cost and like the
Yeah.
cost of being on some of these prescription medications for the rest
Mhm.
of your life, they're not
Yep.
cheap,
Mhm.
It's true.
So even making small switches, is going to benefit you in the long. I feel like will,
Agree.
Yeah.
benefit you
Agree.
in the long run.
small
Mhm.
changes.
So Renew Vitality in Lafayette, Louisiana. My cousin Emily Alamo. She offers a personalized holistic approach to your health and wellness, as you've been hearing us talk about. She offers services from primary care to hormone replacement therapy. But y'all, it's not just for women. Okay, this is men too. She can see the men as well as the women. And you can be on your way to optimal health naturally. You can book an appointment with her at renewedvital.com. And that's the best way to get to her, to book online, and then you're going to get all these wonderful questions.
And if they're not around here, Emily, you do telemed style
If
appointments?
they're in the state of
Okay.
Louisiana, I am currently working on getting my compact RN licensure and then applying for nurse practitioner licenses in other states.
Okay.
Wonderful.
So currently Louisiana residents.
Correct.
Gotcha.
Wonderful. So revitalize your health and reclaim your life with Renewed Vitality. That's renewedvital.com. All right. Well, I mean,
I'm trying to think of any
We
other
have any
question.
other?
We could have a whole topic on. We could probably just dive into one little aspect. And
oh yeah, all the
it's
different
like,
avenues.
Yeah.
But yeah, I guess it's so interesting to me. It was an epiphany moment for me that there was this.
mm,
That this was available, but people really don't know about it. And so it can't just be you, like even in other states, there's got to be,
Oh yeah, and
you
there's also more. There's other providers too in Lafayette that do offer, like there's naturopaths,
hmm
mhm.
and like I said, Dr. LaFleur
So
is more
ask,
Mhm.
functional,
so ask
integrative.
around
Ask
if you don't live
around.
around here, it's worth it for for your
Mhm.
health. Ask around to try to find you a doctor that is going to really care about solving these issues for you.
Yeah,
And
getting to the root of the problem.
yeah,
Because I think that's important. That's really what you want in a provider. You want somebody who's going to take the time to see about you and not just focus on the issue and like be like, okay, let's pass
yeah.
something over that real quick. But anyway, I
Yep.
just thought it was interesting, and we thought y'all would like to, maybe listen to that and find
hope
it
you
as
learn
interesting
something.
as
Yeah.
we did. Yeah.
Hope you learned something about the options that you have.
Mhm.
Yeah. And that, like, if you just I was just curious, like, honestly, not having a whole lot of symptoms, but just curious to know more about my body and what it's doing,
Mhm.
and see if there's any areas to improve upon.
Mhm.
So
Yeah.
if you're just curious like that too, that's an option for you.
Mhm. You got to do a physical at least once a year, so you might as well see what your options are.
That's right.
All right. So thank y'all so much for hanging out with us. Say thank you
Yes,
for
Emily,
hanging out
thank
with
you.
us today.
Well, thank y'all
Educating
for
us.
having me.
And so you can like we said, you can get with her at renewedvital.com, but that was a fun one. And we'll talk about our Longs products, our Grand
Yes.
Consent.
Le Grand
Grand
Croissant
Consent.
sponsor, Long's Products. Y'all, they are a family-owned and operated company out of Alexandria, Louisiana. They do janitorial and cleaning supplies. But not just that, y'all. They have stuff like they have cleaning chemicals, obviously, but they got mops and brooms, trash bags, to-go plates, your foil, films, gumbo bowls, and all kind of cleaning stuff, and household items. You can check out their website at longsproducts.com or all the social media channels, especially TikTok. Go check that out because they have some funny ones there.
Yeah.
All their handles for their social is at Longs Products. And their chemicals, their Pelican brand chemicals, y'all, they just went viral on TikTok. They're good stuff. Yeah. It's very
A
concentrated.
little goes a long way.
Yes. And
that means it stretches your dollar.
It stretches your dollar. We like a bargain around here.
We do.
So check out longsproducts.com for all your janitorial and cleaning needs.
Thank y'all for being our grand sponsor too.
Yes, thank you, Longs.
All right. Well, we'll see y'all next time.
Mm-hmm.
Thanks for joining us on Coffee Talk with the Cajun Mamas. We hope you enjoyed your cup of coffee and our chat. Don't forget to subscribe and share with your friends. Until next time, keep the coffee brewing and the conversation flowing.